Parents of young children, here are some tips and preventative measures to help keep your child safe and healthy at home. Hi, I'm Dr. Zhang Huipei, a family physician working in Paddington Medical Clinic. My main clinical interests are pediatric baby cases, children cases, as well as women cases, but we do see a large variety of general practitioner cases as well. And this is Dr. Lee.
Hi, my name is Dr. Joon Loong. I'm from Paddington Medical Clinic. I work closely with Dr. Zhang, and we have set up a clinic since November 2020. My main clinical interests are actually babies and children's health, as well as surgical procedures done in a GP clinic setting. Also, I attend to a lot of sports injury cases also, and we've set up a clinic since November 2020, and we've served close to 22,000 patients already.
Okay, so for children, there's quite a large variety of presentations. So like a child, an infant less than 1 year old will present quite differently from a preschooler. So it really depends on what they come in for primarily. Most of the time, parents bring in usually for fever or sometimes other symptoms like flu-like symptoms or diarrhea, vomiting, those symptoms. So if it's fairly clear-cut and there's some what we call localizing symptoms, means we know where it comes from, then I will just usually give appropriate medical advice as well as medications for that condition. In the very common situation where kids come in with undifferentiated fever, so usually parents bring it on the first or the second day and there's no specific reason for the fever. Of course, after doing a thorough history taking as well as examining the child, means checking the ears, the throat, any rashes, sometimes I cannot identify a specific source. So I may choose to manage one or two ways. Sometimes I will advise parents accordingly what to look out for and then ask them to do what we call watchful waiting. So over the next couple of days, monitor the child at home for the relevant dangerous symptoms to look out for if there are any issues to come back. And sometimes the child recovers on their own. If the fever is very high or the parents are very concerned, sometimes we do offer rapid kit testing which we have available in clinic, which is like influenza testing. We can do RSV testing, adenovirus testing. So those actually help with localizing what is the condition and sometimes helps with parental anxiety as well.
We do quite a lot of extensive testing, as what Dr. Zhang explained just now. We are a strong proponent of not using too much antibiotics, especially for children, because we breed antibiotic resistance, they create diarrhea problems and gastrointestinal problems. So that's why we have rapid test kits for influenza, respiratory syncytial virus, as well as adenovirus. We even have other things that we can do, like PCR tests for different kinds of coronaviruses, rhinoenteroviruses, and so many other things. So all these things gives parents a very, very clear-cut diagnosis for that particular presenting complaint, which is the respiratory complaints. But to chime into that, we also do stool tests, very dedicated stool tests to identify the pathogen involved, even though most of the time it's rotavirus, norovirus, and all these other viral infections. But sometimes, in fact, recently we're picking up a lot more salmonella cases, a lot more E. coli cases, which actually cause quite bad infections in children. So after doing these tests, then we can establish clear-cut diagnosis and therefore guides treatment very, very well. And all these tests are done actually, we actually do these tests to avoid sending children to hospital.
So if a child has very high fever, more than 38.5 degrees, or very poor feeding, or the child is very lethargic even when the fever is not around, then generally these are common signs and symptoms where parents will bring their kids in for evaluation. So of course, for more experienced parents, sometimes they might monitor the child for 1 to 2 days, and then if let's say the fever doesn't come down, then they bring in. Either way, for most parents, I would recommend, if let's say there is an element of anxiety or there's no clear-cut reason why the child is sick and they're worried, to also bring in to see a doctor. But if they can manage, sometimes for the first 2-3 days, with just some simple supportive measures at home, like bringing down the fever, sometimes the child can get well on their own.
If you're concerned, you should seek medical attention Just want to highlight a case that we both saw recently, in the last 1 week. There was this mother who was very concerned about her 9-year-old child. 9 years old, not very young, not very old either. But this child had persistent fever. It's really, really persistent, hitting 40 degrees. And by the time the child saw Dr. Zhang first, and then she did the initial evaluation, and I followed up the case, the child there were certain tests that were warranted. And thanks to the tests that were warranted, an accurate diagnosis was made, and the child recovered within 48 hours of starting treatment. So I would like to highlight to parents that if you're concerned, please bring to seek medical attention. Don't let your child brew at home. Don't let the illness brew at home.
Okay, so if let's say your child is fairly well, the appetite is still pretty good, the fever is not too high, and is still active at home, there are some simple measures you can try at home before considering to bring to see a doctor. You can just try simple cold compress or frequent showers for the child to bring down the fever. Or if you have over-the-counter paracetamol and ibuprofen, it's okay to alternate the medications to keep the fever down. If the child is having a bit of congestion, you can use those over-the-counter nasal saline sprays to help clear the nose. Those are, and of course, don't wrap children in blankets. It actually generally worsens the fever. So these are some simple things you can try and monitor for 1 to 2 days. If the child is deteriorating or the fever is getting worse and getting more lethargic, then obviously bring to see a doctor will be a safer option. So for common mandatory vaccinations for children, that will include the regular 6-in-1, 5-in-1. So all these actually covers a lot of the common infections that they do see in childhood now. So the ones that I want to particularly point out are the optional ones, because sometimes parents miss these out. Those include things like chickenpox and rotavirus and influenza. So because these are not part of the mandatory childhood vaccination, sometimes they are not aware that there are these options available as well. So especially for influenza, usually we will recommend to vaccinate children at least yearly for it, because we do see quite a fair number of influenza cases because we do influenza testing in our clinic. So normally if we do pick it up, usually we will recommend parents right after they've recovered from influenza to get the vaccination, because it actually covers 4-in-1. So whatever they've just recovered from, they can still catch influenza again. And these are the common circulating viruses that we do see in a lot of preschool children. Okay, so this of course best effort. This can be difficult in young children, but generally they do fall sick an average of 11 times per year. So that's almost every month. So to try and reduce the chances of your child falling sick, you can try some simple measures like teaching your children how to wash their hands. Sometimes they touch their faces very regularly and you can make them more conscious of it. But more importantly, to wash their hands frequently, especially in school before or after meals. Then of course, regular vaccinations, like we mentioned earlier, will be helpful to prevent them from catching infections. Of course, mask wearing now is optional. It can be difficult in young children, but that will help to reduce the risk of transmission. And lastly, which is quite important, which I feel many parents do not do, is try to make sure your child fully recovers before putting them back in school. Because when they are semi-recovered, they're still very susceptible to falling sick again. But sometimes they catch one virus, because we do a fair number of testing. Sometimes we see some children have 2 or 3 viruses at the same time, and they cannot recover in 1 to 2 days. They usually take at least sometimes 4 to 5 days or even a week. So if you can keep your children at home just for the 1-2 days extra and let them fully recover, when they go back to school, their immunity is better and they are less likely to fall sick again.
I would like to add on to that point. If your kid is sick, do not send them to school, number 1. And if your kid is recovering, still don't send them to school. If your kid is fully recovered, probably add 1 more day or 1 or 2 more days and then send them back to school. This actually helps to stem the transmission of the disease, as well as to build up your child's immunity and then let them go back to school properly also.
So kissing your daughter is well protected now?
Yeah.
For now.
Yeah.